Hi. All right. So today we are going to go through the slides that you have missed so far this week. And we're also going to hit some of what is to come. And I went ahead and I emailed your mom the guided notes as well. However, just know that that document is probably going to update. So I would actually wait until the end of the day today. So probably about I would say about 3 o'clock before you get started. I hope you get tons of rest and fluids, and I hope you feel better soon. All right, so we're going to go ahead and get started. This was Monday, and what we did was another holiday shape to put your name on it with prizes for stickers. And then again, on the last day of our class, we'll have a special prize for the person with the most stickers earned. What you guys did this day was you actually made SAF meds from your skeletal diseases and conditions. These are terms that we're going to test on Friday. And obviously, I will go ahead and just take your midterm grade and replace it with this exam grade. So don't worry about being here on Friday. Really just important that you're here for the midterm. Okay. So, this is diseases and conditions of the skeletal system, diagnosis and treatment. Tuesday, we had a warm up. So, the question was, what is the name for a medical doctor who specializes in the musculoskeletal system? I want you to use a complete sentence to answer this question. I'll give you a couple seconds now. And you can pause this if you need a little bit more time. But the answer is a doctor of osteopathic medicine. These are doctors who are not medical doctors, they're osteopaths, and they actually look at and study the musculoskeletal system extensively, and they take a whole person approach to treatment and care. So these are doctors who are going to really look at things like, okay, you have lower back pain. Let's look at your BMI. Let's look at, how much exercise you get. We're going to take the alternative route before we treat you with, or before I refer you out to someone who specializes in pain management. Okay, so today we are going to analyze diagnostic tests and treatments for diseases and conditions affecting the skeletal system. Again, time for your SAF meds. You can time yourself at home. This week, we do not have a warm-up sheet because of the guided notes, but you can record your SAF meds on your own. Just time yourself doing them for a minute each day, and then give me your finished graph and data table next week when you get back. Okay, so the way this works, if you're following along with your guided notes, everything that is very important is going to be in the red boxes. The things that I want you to know for testing purposes are going to be located in the red boxes. The things that are important, but maybe not necessarily something that I want you to test on, that's going to be outside the box because I'm sure you know I love giving y'all information. Okay, so let's go ahead and get started. So primary care physicians, these are general practitioners who can treat a patient for most conditions, but sometimes they are going to refer out for those skeletal system diseases that we have talked about so far. We're going to refer to either someone like an orthopedic doctor or orthopedic surgeon or a rheumatologist who is going to specialize in arthritis and other diseases. So here we have a new activity. It's called a Think and Ink. So I'm going to present you with a question. Think about it and then write for 1 minute. Why would a provider refer to a specialist? So basically, we actually encourage providers to refer out because primary care physicians are really going to be for those diseases that don't need that extra attention. So things like high blood pressure without any type of coronary heart disease, that's something your primary care physician or your PCP can manage. However, if we have something that is more intricate and involving multiple systems, we do want to specialize. We want to refer to someone with a specialty in that field, like a rheumatologist. All right, so we're going to go through the types of testing. This is just a preview of what's to come. I'll let you know which ones are blood tests, which ones are imaging diagnostics, and it's going to be very handy if you keep a little list going, and I gave you spots on the guided notes to do so. Okay, so the first one we're going to talk about is the serum rheumatoid factor, or the RF. This is a blood test. It's going to use your blood serum levels to detect immunoglobulin in the blood, so to indicate a diagnosis of RA, rheumatoid arthritis. Basically, so this box over here, this one right here, this is very complicated. This is probably graduate level college, I would say, or at least your senior year. But this is the rheumatoid arthritis immune disease pathway response. So these IgG stands for immunoglobulin. So IgG is in our blood at all times. Think of it as very specific white cells, right? And we know that white cells are responsible for an immune response. So these white cells come and they form particular pathways. What they'll actually do is they will form what's called a complex. This IgG and IgM will complex together, and they will activate a body response, which is called a complement. And the complement then will send cytokines, which are signaling cells, and the type of cytokines that they send in response are going to be inflammatory cytokines, which are responsible for inflammation and damaging the cartilage and destroying the bone. This is a really cool pathway, which is why I've included this. But what this serum rheumatoid factor, what this blood test, this RF blood test is doing, is it's actually looking for this complex right here in your serum. If you have this Ig complex, this immunoglobulin complex, you have a 50 to 95% chance of having rheumatoid arthritis. So this is a really great way to distinguish rheumatoid arthritis from osteoarthritis, because we aren't going to have the same responses in the body. So this is one way that we can test between the difference of the two. Right? So next up, we have a calcium blood test. A calcium test is used to check for levels of calcium in the blood. Increased levels of calcium can be an indicator of bone cancer, acute osteoporosis, if you're prolonged and you're immobile, as well as fracture healing. So think about osteoporosis. In osteoporosis, we have bone that has an inability to rebuild that spongy bone that's on the inside, right? That's the part that's breaking down. And so all of that extra calcium and minerals, so the calcium, the phosphate, the minerals that are stored inside of bone have to go somewhere. And they go into the bloodstream, and through the bloodstream, then they're filtered out and excreted. But if we have a lot of calcium in our blood, that means it's not in the bone. So when we have increased levels of calcium, that's when we have a good indicator that we probably have some osteoporosis going on. And then, the opposite is true. So if decreased levels of calcium, this can actually be a indicator of osteomalacia or rickets. That means that there's no calcium in the blood. So, that's because our body is starving for it, right? Our body is going to filter that calcium out and put it where it needs to go. So when we don't have enough calcium in our blood, that's usually an indicator that there's a shortage, right? So osteomalacia, that weakening bone, so that bone's not able to build up because those minerals just simply aren't there. I hope this is making sense. Again, email me if you have any questions, if you're confused about anything. The next one that we're going to talk about is the C-reactive protein blood test. This is a very